Dr. Angel Nelt is going to take us from here.
So out of all of us here tonight, if you or a loved one has ever been affected by cancer, raise your right hand. If you or a loved one has ever been affected by heart disease, raise your left hand. If you or a loved one has ever been affected by medicine, vaccinations, unneeded surgery, or overutilization of the medical system, raise both hands. Look around the room. When is enough enough? The top 3 leading causes of death in America here today are just that. Number 3 is cancer. Number 2 is heart disease. Number 1 is iatrogenesis, meaning death by medical error, medical malpractice, botched surgery, overprescription, or overutilization of the medical system. If we were to look at VAERS, right, Vaccine Adverse Effect Reporting System, and knowing that less than 1% of the deaths and injuries are recorded, that means over 99% are not even documented. I firmly believe that iatrogenesis coupled with VAERS far exceeds the cancer and heart disease deaths combined. That's a crisis healthcare system. Yet we live in a time where they spent billions of dollars, decades of research, and you still have organizations like the American Heart Association, Susan B. Komen, out to find the verdict for the cure for cancer and heart disease. Yet we also live in a day where the tides have shifted, where you have the mother just down the street who walked out of the pediatrician's office because they refused to respect her request to not vaccinate her child. My friends, we the people have spoken, and the good news is we have been heard. Over the next 19 minutes, I get the opportunity of sharing with you what I believe to be the greatest message in health, a message that has changed my life personally, and having a private family office, I get to see it change many other lives too. Michelle asked me tonight to talk about how we have the topic of the conversation around the topic of vaccinations in our office. So my goal tonight is to give you some tangible things, and my hope is that it brings you some value to use to talk to your family members and loved ones about the topic of vaccination. Okay, and the reason I'm excited to be here, sorry, I'm a walker.
Yeah, you have to walk great, Ed.
Thanks. So the reason I'm excited to be with you guys and be a part of this movement this evening is my story started, I grew up medicated, vaccinated, and sick. Okay, I was 5 years old, sitting in a cold oncology room. This is up at Penn State Hershey Medical Center. There was a knock on the door, doctor walked in, said, "I have bad news." Looked at my parents square in the eye and said, "Your son has leukemia." "Not my child," said my mother. "Is this the cards he was dealt? Is this the way it's always going to be?" So they recommended chemo and radiation, and after a couple months of doing that, the doctor came back and said we were wrong. It's not leukemia, it's something called ITP, idiopathic thrombocytopenia purpura. So essentially what they told me was my body didn't produce enough platelets. And they feared that if I would play sports, I might hit my head and die. So growing up, I was limited. I couldn't play contact sports. I had to sit on the sidelines of gym class. I remember in the heat of the summer, and by the way, Florida has hot summers, but I would wear long sleeves and long pants to school because I had bruises all over my arms and my legs, and I was embarrassed. Around this same time, my brother was diagnosed with autism, okay, labeled with autism. So for my parents, that was hard to juggle between the two. Fast forward, my parents seeking for hope and answers, they brought me to a principled family chiropractor at the age of 12. And this chiropractor started to educate me on how my body is designed to function and how my nervous system controls all the health in my body. What he said made sense. I started getting under care. I noticed things like my headaches improve. My recurrent ear infections went away. My allergies started to clear up. But one of the biggest changes and improvements I noted in my health was the fact that my blood work started to normalize, to the point where I no longer had that gray cloud of diagnosis that followed me around. Okay? Fast forward, that drove me to become a chiropractor, a pediatric family chiropractor, okay, which I absolutely love. And when I was in chiropractic school, I took a specific interest in the connection between autism and chiropractic. In my last year of school, I met a girl at a restaurant. And she said, "What do you do for a living?" I said, "Well, I'm aspiring to be a chiropractor." She said, "Well, that's cool. I don't really have headaches or sciatica, so I don't really, need what you do." I said, "Well, that's interesting. What do you do for a living?" She said, "Well, I work in pediatrics. I'm a pediatric oncology nurse practitioner. I give kids chemo and radiation at their most vulnerable moment in life." I said, "Well, that's noble. Let me ask you this. Do you vaccinate those children with cancer?" She said, "Yes." I said, "Do you have children you see with ITP?" She said, "Yes." I said, "One more question. Do you believe vaccines cause autism?" She said, "No. In fact, the science of that has been debunked."
So,
Over the next 19 minutes, I get the honor tonight of sharing with you the conversations we have in the office on a regular basis. Would you guys agree that if a nurse practitioner is confused about what health is, other people can be confused too? I mean, we see it in the office pretty regularly where people come in confused about health. And I love asking the question of what is health? And the two most common answers I get is, "Doctor, I know I'm healthy because I look good or feel good." Well, people feel good every day and have heart attacks, feel good every day and have cancer. So if we just base the health off the mindset of if it's not broke, don't fix it. If I feel fine, I'm healthy. And if I have a pain or a symptom, then maybe I'll do something about it. That's a reactive mindset. And I truly believe, thanks, Michelle. I truly believe that that's why we're ranked dead last when it comes to first world industrialized healthcare systems. We are 49th out of 49th. So what does that mean? That means they didn't compare the United States to Haiti, right? First world, we are dead last. Okay? So if health isn't about how we feel, it's about how we function. And what controls all the function in our body? It's our nervous system, right? Brain, right? And our nervous system controls and coordinates everything for our heart to beat, lungs to breathe, food to digest, hormones to regulate, through our spinal cord and nerves. So most people know that the brain controls it all. A lot of people know that the job of the spine is to protect our nervous system. But what a lot of people may not realize is what the nervous system actually does. Let me give you an example. If we had a room full of people, say it's a classroom, and we all went outside and say the pollen count was really high that day. Some people would breathe, cough, sneeze, get watery eyes. Some people would breathe the same air and be perfectly fine. My question to you, is it the pollen or the body's inability to adapt?
that's odd.
Right? That's where our nervous system comes in play. Love them or hate them, the World Health Organization said the number one cause of cancer, heart disease, chronic illness is stress. But it's not stress, it's the body's ability or inability to adapt to the stresses we're faced with. And that's the job of our nervous system. We have children that come in their office, babies. I look in their eyes, they're clear, they're connected, they're healthy. We have newborns that come in our office, I look into their eyes,
In the beach girl.
they're disconnected, their tone is off, they have aberrant reflexes, delayed primitive reflexes. Something's off. And my first thought is, was this child vaccinated? What stressor on them is their body not able to properly adapt to the point where it manifests symptoms as a warning sign? You follow me there? If we went home tonight and our fire alarm went off, we wouldn't just get out of bed, take the batteries out of the alarm, because if you do that, the house burns down. Okay? Now, we talk a lot about in the office of what are causes of stress on the nervous system. We have the physical, we have the emotional, and we have the toxic. So physical, that's slips, falls, accidents, injuries. The emotional, we're talking things like the dog died, tax burden due, rent is late, loss of a loved one. The toxic stresses, medications, right? Vaccinations, red dye 40 in our food, chlorination of our water, right? The literature shows that for adults, the number one stressor on the nervous system is the emotional. The literature also shows that for children, the number one stressor on their nervous system is the toxic. The current vaccine schedule today, it's a total of 73 shots for 17 diseases, 28 of those within the first year of life. 28. In my mind, that's not healthcare. That's a sick care model. And that's not setting up our future generation for a lifestyle, but a death style. See what I'm saying? So I had this boy that came into the office, and he was 5 years old, used to walk, used to talk, used to play sports. No longer walks. He walks on his tippy toes. No longer talks. He has to make high-pitched squeals to communicate. Can't play sports, started to have seizures. You ask his mother, what's the cause of her son's decline? She said 100% the MMR vaccine. Convicted about it. You see, when they brought their son to the office, they were doing everything that they knew to do at the time. Physical therapy, occupational therapy, chelation therapy, all good. But a lot of it was an outside-in approach. Okay? So understand there's healthy things we do for our body, but if the body is not functioning right from the start, through what controls it all, and that's our nervous system, those children are never going to get the fullest benefit that they could. You can chelate, filter the liver, kidneys, blood all day from the heavy toxins, which is good, don't get me wrong. But health comes from within. Healing comes from within. Right? So there's things we do for our health, but we got to focus on healing from within first. So as we started to take that perspective and work with allowing his nervous system to better adapt to the stresses he was faced with, he's starting to improve. He started to have better scores in physical therapy, occupational therapy, okay? And I'll never forget the story. One day his mother came into the office and said he was able to muster together 3 words. They were not able to communicate in a long time, but muster together 3 words: I love mom. So it's stories like that, okay, that inspire me, that motivate me, and honestly, that's my why, okay? So I share that with you tonight because how we talk about vaccines in the office is a very specific way to do so. There was a study done in 2021 that showed why people received the COVID shot, and there were 3 reasons why: fear, frustration, or not knowing any different. So if somebody feared the virus, they would get the shot. If somebody was frustrated, meaning they felt coercion from their family, their coworkers, their friends, they too would get the shot. If somebody knew no different, meaning they were led astray by their doctor or a doctor that didn't follow the real science, they would get the shot. Well, we use the same exact framework in our office to educate our patients. Now, we're not big advocates on fear or frustration. We understand that people have a different understanding about the topic of vaccinations, so we strive to meet them where they're at with empathy and lead them with love to where they could be. Follow me on that? So I tell you that because, where was I in my talk, honey? I'm glad you came tonight, by the way. I had to drag her here. But anyway, so understand that, you know, we can look at it in this way. If a child's born, are they designed to have shots in the butts, drops in the eyes, be labeled and prescribed to live a life less than their fullest potential and die an early death? Or do we believe that that child's born with everything it needs inside of it already to be healthy, knit together in its mother's womb in a perfect image, and God don't make junk? And what we found is that every single person, it stems down into those 2 belief systems. Health either comes from the outside in or from the inside out, meaning we're dependent on a man-made substance, pill, potion, or lotion, or we have confidence within ourselves and how God designed our body to work. That's what it stems down to. So everybody's on that scale at some level. And our goal is to meet them where they're at and take them a little bit higher up that scale to an understanding of health from the inside out. How do we do that? We share resources, books, magazines, websites. One of my favorite books is Dr. Brian's Vax on Vax book. If you never read it, and phenomenal book. Phenomenal book. The Defender. If you're not subscribed to The Defender, phenomenal resource. Now, in light of time, I don't have time to share everything with you tonight, but I will tell you this, that it's not just one conversation. Okay, it takes time, it takes patience with some of these people, it takes empathy. But if you're interested, what I'm going to do tonight is give you a gift. I had my team put together a document of what we give to our patients to influence them up that ladder in this understanding of the topic of vaccines. So if you're interested, all you got to do is text the word MAHA to the number 561-396-9838, and it'll send you that document. There are local pediatricians, the contact for the religious exemption in Florida, 561-396-9838. 561-396-9838. How do you spell MAHA? Okay. All right, text MAHA to that number if you're interested. So that's my gift to you. And like I said, there's great resources on there that we point families to that direction. Nothing hurts me worse than to see a newborn come in and, I see him a week later and something's off, and it's vaccination. So I share this with you. Do you guys remember that girl I told you about at the start of this talk, the one that I met at a bar or a restaurant? It was a bar, actually. She was a nurse practitioner, vaccinated kids, right? Give them chemo, vaccinated on top of that. Well, she became my wife. And we have three beautiful children today, all of which got adjusted from birth, not because they had a health issue, but because we know a properly functioning nervous system will set a positive trajectory for their health as they grow. All three have not been vaccinated and never will. So, do you guys believe that if a nurse practitioner can make that shift to become an advocate for self-autonomy, other people can too? Right on? Okay. So I encourage you in that. Be bold. The momentum's on our side. Bobby Kennedy spoke at a chiropractic conference back in 2016. He was the keynote speaker. And actually the topic was Make America Healthy Again. So they had the hats, they had the shirts, and he talked about the vision of what we're seeing today. I didn't think I'd see it in my lifetime, to be honest. But the tides have changed. The momentum is on our side. Okay? And we see this in the trenches regularly. Doctor means teacher. And a teacher is a leader, and everyone here tonight is a leader. And the job of a leader is to intercept the paths of others to let them know that they matter. So I encourage you, be bold in your testimony. People are praying to hear this truth. Because when you're committed to a cause bigger than yourself, you can only help but change the lives of others. Thank you.